Yeah, so what I'm doing right now is kind of grooming the fur and I could see fleas on her right now already while I'm just going through the fur with the brush. Yeah, I mean I just saw one crawling around here. But yeah, basically
Did she eat the thing?
Not yet.
No.
I'm just kind of getting a feel for this, and then I'm going to get a little bit more comfortable, and then I'll slip it through the side of the mouth. But yeah, she's crawling with fleas right now.
No,
and basically after, if you look closely, after like 30, 45 minutes, 1 hour, like around that time period, you're going to start seeing fleas just kind of, falling off the fur. Like kind of just, you could tell that the flea is injured by being intoxicated by this poison. Yeah, totally. It's amazing the speed that this thing just really starts getting into the system really fast. But here, let me see if I could slip this in the side of her mouth.
Okay. Good luck.
You want to stick around and see this? Yeah, I think I'll do it.
It's probably only effective for like what, 30 days? Is it a monthly thing?
It's an instant thing, and it's gonna it's gonna kill everything on her like within a couple hours.
Yeah.
But you got to clean up the environment, so nothing hatches and latches onto her again,
Oh, good luck. She's not a very compliant cat. Oh, poor Polly. She's not an easy cat to care for.
Yeah, hold on.
Did you get it in her?
Yeah, the pill's in there.
It looks like it's on her lip.
It's in the mouth.
Oh, okay.
It's in the mouth. Here, could you give me another treat?
Yeah.
Just stuff in there. They're on the table over there.
No, they're on the dry.
Yeah. Yeah, basically, just to make sure that this goes in, okay, so the pill's in there right now. I'm stuffing one more treat in there, and hopefully she could just chew on this.
Ooh.
Yeah. Hold on, I'm keeping her mouth shut, so I don't want her to spit it out. But yeah, it's okay. Make her feel a little bit more comfortable. But yeah, hopefully she'll swallow this up. Yeah. No, it will definitely work, man. This stuff works. For real.
What was it called again?
There's Cap Action, the one that I have right here is Cap Action, there's Capstar. It's all the same active ingredient.
Okay.
Mm-hmm.
I'm gonna write that down because I won't.
Oh, it's easy to find. Yeah, you just go to the store. That's the only pill that they have in there. Yeah. Yeah, so I already put the pill in the mouth, and I'm kind of massaging. I got her head turned up right now the whole time.
Yeah.
And I'm kind of massaging the bottom of the chin and stuff, and I think it's kind of going down a little bit.
Okay, well that's good to hear.
Yeah. Yeah, because I definitely don't want her to puke it out or spit it out or anything like that. But yeah, it seems to be... Yeah, she's chewing a tiny bit. See if she can kind of get it down.
Yeah, I'm used to doing this with dogs.
Uh-huh.
I've never done it with a cat.
What? Force-fed a pill?
Yeah,
Really?
I could get a pill into a dog in no time at all.
Yeah, holy shit, there's a flea right there. You feel that. No, I think she's all right. You know, she's not right now. She's fine. I don't think I could do this with Mersbo like this.
Really?
I wouldn't be able to do this with Mersbo. He'd run away from me.
Yeah.
You know, but she's good right now. Yeah, I could feel a flea right now, touching her right here. But they're all over her, and you're gonna see, they're just gonna be popping off. Yep.
Okay, well, thanks for your help with this.
Yeah, no, this is great, man. This stuff is really great.
Yeah, I didn't even know about it, and I just read
Neither did I. I randomly saw this because the last time I was over, I stopped by Walmart on the way home and just saw it, and I was like, you know, I looked at the section, which I don't usually. I just go straight to the cat food section, but I went to the cat, you know, the other cat stuff section, and just looked around a little bit, and I saw the pills, and I was just wondering if this even is this really effective, and sure enough, it really is.
Okay.
Because I wasn't going to try another collar, because I know the collars don't work and the topicals don't work.
Well,
and this is the one thing that I haven't tried.
I'm glad I was here. She came up to me. She had her collar caught in her mouth.
Oh God!
She had tried to push it off.
Yeah.
And just slipped it down far enough she couldn't get it off.
Yeah.
But it was literally in her mouth and around her neck.
God, man, that's terrible.
Yeah.
No, the collars are fucking terrible. They're full of poison, and they're just you know suffocating, and they could choke on them, and you know if they get their collar caught, you know sometimes it could be fatal.
Yeah.
It's terrible. I'd imagine right now, even right now, it's been in her mouth for like 5 minutes or whatever.
Yeah.
It's probably starting to dissolve into the system right now because the saliva is just kind of melting it away.
Sublingual.
Under
the tongue.
It's kind of in the throat. That's that's where I put it in.
Yeah, but there are medicines they tell you to take sublingually. You put them under your tongue.
Oh yeah.
And let them kind of absorb in a little slower than if you swallow the pill.
I could feel her swallowing, you know, her throat. And she's not even trying to run away right now, you know? She could totally run away if she wanted to.
Yeah.
So I felt, you know, two swallowing gestures on her throat. Yeah, 2 gulps. So I think it's kind of going down.
Okay.
But she's been really well behaved on this thing, you know? And I'm kind of really surprised, but yeah, amazing.
Yeah, I'm surprised too. Normally she'd struggle real.
Yeah, she's been really good.
Violently.
Oh, totally. No, not at all. She's been really, really calm the whole time. Yeah. Really? Did you send it out?
What's that?
Did you fill it out?
No, not yet.
Uh-huh.
I got till the 3rd of November to get it mailed.
Yeah. I already mailed mine out yesterday.
Yeah.
Yep.
Did you just stick it in your mailbox? Or?
I went to the post office because I had a bunch of other shit to mail out. You know, I just gave it straight to the lady. In fact, the post office lady, because we know them really well because we go there all the time, she signed as the witness for mine. Oh. You know, so can you sign this as a witness? Yeah. I think she got it, man, because she didn't spit it out. You know.
Yeah, and she's holding her mouth shut or anything.
No, she just chewed a little bit more just now, and I think she's got it. Okay. Yeah. Amazing. Okay, perfect.
See what she does when you back away. Are you nice and calm? Oh, something just came up.
Came out?
Yeah.
Spit? A tiny bit of spit.
Yeah.
Yeah, but that's just buildup. I don't think that's
the pill.
I didn't see the pill. That's just clear
yeah,
spit.
Okay.
Just because she's been in a position where it's been building up. But I think it's gone in her throat.
Yeah.
You know, because I was holding up for like 5 minutes at least.
Yeah.
And then that gives time to kind of go down, and I was kind of massaging a little bit. I think she's got it. Maybe she likes this a little bit, you know, it's kind of nice. Yeah. Good. Yeah, it's in. It's in. Yeah. You're a good girl. She's got it. She's good. You're good. Yep. One more.
How's she doing?
No, she did really well. Yeah. I think she got it totally.
That's good.
You know, and she doesn't even need another treat or anything like that. Because that was like a treat and a half or like 2 treats just now that were shoved in her mouth. Okay. And kind of, she did make a few chews and it went down.
You'll need a cloth for that Capstar.
It's not much. It's just like a couple drops.
Yeah.
Oh, she did amazingly well on this.
Let me get.
Yeah.
I can't spit up.
Yeah, she's fine. I would like to flea bomb my house. I mean, flea bomb this, flea bomb, you know. That's actually the best thing to do, but you got to be out for 4 hours. That's the problem.
Really?
Yeah, no, I mean you can be in your place while it's getting bombed.
What about the cat? She'd have to be out for 4 hours.
Exactly. No, I mean for this place, you know, I would recommend opening the windows in there, and then in the garage and put it in, you know, just so there's a little bit of vent, and then put the cat in there.
Yeah. And
then, well, first of all, the whole place, everything's got to be cleaned up, and then bomb it. Give the pill. And then you're done. You know, that's a legit, you know, that's a really legit way to get rid of the fleas, I think. you know.
And Walmart has flea bombs?
Yeah, you could get them from there. You could get them from Home Depot, Walmart, whatever. I get them all the time, yeah.
Oh, no, I've never used one.
Yeah, for this house, you'd probably need one for the kitchen, one for this room. You know, you need they give them like a 6-pack. You could go to Lowe's and get a 6-pack of them.
Oh, okay, yeah, I've never bought them.
Yeah, but they're...
Here with the tiles, I don't think I'd even want to use it in here.
What you're supposed to do is put a piece of newspaper on the ground, or a piece of paper, whatever, put the flea bomb, set it off, put it on the paper, and it'll just kind of go off. And then you go to the next room, do the same thing, go to the next room, do the same thing. Open up all the cabinets so that so it could infiltrate like all the space, like in the cabinet space and everything, and you know, behind the washing machines and all that stuff, behind the sofas and all that stuff, and it'll get everything. We do this all the time for the apartments and stuff.
Oh, okay.
So I mean, yeah, that's what you got to do.
No, like I said, I've never used one. Though I know somebody blew up their house using them.
What?
The propellant in them is propane. So somebody had like 12 in one room, just way too much, and it caught on fire. Probably the pilot light from the stove or something like that. But I do remember reading that someone blew their house up with a flea bombing.
That's crazy.
Yeah.
Huh. Yeah, and doing this right now, the brushing is also circulating the blood too, you know?
What's that?
What I'm doing right now, just like brushing like this, is also circulating her blood, you know, through her system. So, I mean, it's also, I think that's also helping to distribute the medicine.
Yeah,
you know?
yeah, that makes sense. Plus, she loves being groomed.
Yeah, no, it's perfect.
Yeah, like I said, she usually gets 2 grooming sessions a day. I just wish I could get her to eat more moist food. But she just doesn't like it at all. Like I said, I gave her some this morning because she was acting like she was hungry. So I just gave her, you know, a little bit of Fancy Feast.
Yeah.
She drank all the water.
And same thing.
And left the chunks of food.
You know? Yeah. You know what I noticed the last time I tried the Fancy Feast?
Yeah.
Those the little chunks in Fancy Feast are surprisingly hard.
Oh really?
Yeah, seriously. I'm like, what the hell is this?
Oh.
You know?
Yeah.
It seemed like it was either it felt like it was like stale material, or I don't know what the fuck it was, but it just didn't feel right. Maybe it might have something to do with the food, because sometimes, like, I know that she went for the special kitty, kind of like the pate texture. I think she goes for the pate more.
That's what she had this morning, and she didn't eat it.
Really?
The whole thing I have in there, a Blue Wilderness.
But I thought you said you gave her Fancy Feast this morning.
I did, but now she's going straight to Blue Wilderness.
Yeah, and she goes for that, right? Or
it's
no? Yes,
miss,
really?
You know, when I gave her, when I first got the case